Hi, I'm Graeme. Now, in this video I'll show you the simple massage you can do on yourself that's proven to help a lot with headaches. Now, to show you what's possible, this chart is from one of the trials where this has been tested. Now you can see that before they started the massages, the people were getting about 6 headaches a week. Then after they did the massages, it dropped to 2. And those remaining headaches were a lot shorter and less severe. That's a hell of an improvement and something you can easily do yourself. So with that, let's show you what you need to do. Now, I've divided this video into 3 sections. I'll pop the times up so you can skip to where you want if you need to. In the first section, I'll go over the points you should be massaging and why the results should be so much better than the typical pressing on a few acupressure points you usually see. Now the next I'll go over the basic examination and treatment techniques, and finally I'll demonstrate complete examination and treatment. Now, so you don't have to try and memorise everything, I'll link to our web-based version of this guide in the description. Now it has all the step-by-steps you can refer to with pics and diagrams. Now lastly, I don't want you to be using massage if you have something like a tumour or an aneurysm about to burst. Now there's more information about when it's safe and not in the guide, but you need to treat this as general information only to be discussed with your healthcare professional, not specific advice. So let's look at what you've been massaging and why it is so much more effective than your typical acupressure points for headaches you usually see. Now it's not even close. Now, let's start with the acupuncture or acupressure points you're normally given. Now, these points come from ancient civilizations who found that certain points were associated with certain conditions. Now, they didn't have the science to evaluate them, so they made up things like meridians and life forces. Now, what that means is that if you see a traditional acupuncturist complaining of a headache, all he or she will have is a chart that shows the points that helped people hundreds of years ago. They have no way of telling if they're actually involved or not. Now, according to the theories, you have life forces running along your meridians and the acupressure points can block it. Now, even if it isn't total BS, they haven't got life force meters they can run along the meridians and find the blockage. Now, instead of that, I'll be sharing with you the trigger point method. Now, what's happened in recent times is that scientists have investigated these points, finding out exactly what they are, what they do, and how best to treat them. Now, instead of pressing on a handful of points they found hundreds of years ago, not knowing if they're involved or not, we know exactly what to look for. Now, we have charts like these which show the points in each muscle and where they shoot pain to, and more effective ways to treat them. Now, importantly, too, they've also found a lot of points that the ancient people didn't. Now, in the case of the headaches, the acupuncture people give you a handful of points, but the scientists found points causing headaches in 9 different muscles, with many of those muscles having multiple points. So, let's show you how to massage for headaches using this system. Now, I'll start with the general techniques and demonstrate them on actual muscles involved. Now, the scientists found that the points causing headaches are part of the muscles that have spasmed, bunching up, forming a lump. Now, that means that when we're examining for them, we're looking for parts of the muscle that are tight with tender lumps that shoot pain. Now, with the bigger muscles, use the pads of your fingers to do general examination. And if you find anything that feels a bit tight or tender, use the tips of 1 or 2 fingers to examine deeper, looking for tight bands of muscle with tender lumps that shoot pain. Now, for thin muscles like those over your skull and your jaw, these lumps are often too small to feel. Now, all you do is systematically examine them with the pads of 1 or 2 fingers, looking for spots that feel tender and often reproduce your headaches when you press on them. Now, when you find these spots, there's a couple of ways you can treat them. Now, you can use a combination of massage and pressure, or for some muscles you can use vibration massage. So, let's look at the massage and pressure first. Now, for the bigger muscles like the ones on top of your shoulder, you can put a bit of lubrication on and do slow stroking along the muscle with moderate pressure. Now that helps relax the muscle and stimulates blood flow. Now you may be familiar with techniques where therapists apply pressure. Now when they do, it's often very painful, but science have found you don't need to do that. Now while you're massaging along the muscle, if you come to a tight, tender spot, just stop and maintain the pressure for about 10 seconds and then continue. Now it's very effective and without the pain or potential to hurt yourself. Now, several of the muscles like the ones on the side of the skull and the ones that work your jaw are too thin. Now, you'll be examining them with the pads of 1 or 2 fingers, and if you find a spot that feels tender and shoots pain, just give it a gentle circular rub for about 30 seconds and then apply gentle pressure until it fades or up to 30 seconds. Now the other possible technique is using a vibration massager like one of these. Now this is way more effective than the manual techniques I've shown you, but you can only use on the larger muscles. Now I'll link a guide to how to use a vibration massager, but it's very simple. Basically all you need to do is set the machine on the right frequency to dissolve the points, sit the machine on and let the vibrations penetrate. However, you will need the right equipment. Now, massage guns are not suitable. They drive the heads into your muscle rather than vibration, so they're more likely to hurt you than do good. And you can't safely run them at the proper frequencies. Now, also, typical personal use machines like this that you buy in the shops aren't meant to be serious therapeutic devices. They usually have inadequate mechanisms and underpowered motors, so are not capable of giving decent amounts of therapeutic vibrations. Now, more about all that in the link guide. Now you've got the basics, let's look at the individual muscles and how to do the self-massage in an easy, systematic way. Now, the first muscles we'll look at are the thin ones covering your skull and jaw. Now, as these diagrams show, you have ones at the back of your skull, one's on the forehead you use when you raise your eyebrows, one on each side over your temples and on the side of your jaw. Now for these you go over systematically with the pads of 2 fingers. Now if you find a tender spot, give it a gentle circular massage and then hold with moderate pressure until the tenderness fails or for a maximum of 30 seconds. Now the next muscles we'll look at are the deep ones at the top of your spine at the base of your skull. Now as you can see in this pic, they commonly cause headaches right across your head. Now to examine these, you'll use the tips of your fingers pressing in deeply, and if you find a tender spot you can hold the pressure for up to 30 seconds. Now these can be stubborn, so it's okay to repeat a few times. Now problems with these muscles can sometimes be secondary to joints in the upper part of your spine locking up. Now if they won't fade away or keep recurring, you'll need to see a professional like a chiro or an osteo. Now I can't unlock my own joints, so there's no way you can. Now the next muscles we're looking at are the 2 muscles that sit close to the surface and run from the base of your skull down the top of your shoulder. Now for these, use the opposite hand to systematically examine the whole muscle using the pads of your fingers. And if you find a part that feels a bit tender or tight, use the tips of your fingers to examine deeper, looking for tight lumps or shoot pain. Now if you find anything, by far the easiest and most effective way to deal with them is to sit a vibration massager on and dissolve them. Now again, I'll pop more info about that in the description. Now if you haven't got a proper vibration massager, you can put on some lubrication and apply moderate pressure, slowly moving along the muscle like you're squeezing out an old sponge. Now when you get to the tender lump, just hold the pressure for about 10 seconds before moving on. Now as you do this, you should feel the muscle loosen up, so if you repeat the process, your fingers will go a little bit deeper. Now feel free to repeat the process 2 or 3 times. Now the next muscle we'll look at are the ones that run from behind your ear diagonally to the top of your chest and tend to stick out. Now there's a lot of very sensitive structures underneath these, but you can safely apply pressure by squeezing. Now you can gently squeeze along the muscle, and if you find a tender spot, just maintain moderate pressure for about 30 seconds. Now, I said there were 9 muscles, but I've only shown you 8. The last ones are at the side of your neck, but there are way too many sensitive structures around them to do yourself. Now, luckily, they are the least involved. Now I've shown the individual muscles. I'll show you a quick and easy systematic way to go over them all. We'll start with the thin muscles on my skull and now my jaw. Pads of fingers. We'll start around the back and do across the forehead. The ones up around my temple, and the ones down my jaw. Now, if I find a tender part that shoots pain, gentle massage with a circular motion for about 30 seconds, and then apply the pressure until it fades, or up to 30 seconds. Now, for the ones around the base of my skull, tips your fingers to use deeper pressure. If I find part that's tender and shoots pain, apply pressure for 30 seconds. And I can repeat that 2 or 3 times. Now for the thicker muscles that run from the base of the skull down to the tip of your shoulder, now use the pads of your fingers on the opposite hand and systematically examine along the muscle, looking for parts that feel a bit tender or tight. Do the opposite side. Now, if you find a part that feels a bit tender or tight, use the tips of your fingers to examine a little bit deeper, looking for that tender lump that shoots pain, which often reproduces your headaches. Now, when you find them, you've got 2 choices. Now, the simplest and easiest and most effective way is using a vibration massager. Now I've got more information about that linked in the description, but if you haven't got a vibration massager, you can use the massage and pressure technique. To do that, you put some lubrication on the skin, and then using some pressure with your fingers, just move slowly along the muscle like you're squeezing out an old sponge. Now when you get to the tender lump, just maintain the pressure for 30 seconds and then move it on. Now you can feel free to repeat that 2 or 3 times. Now the last muscle is the diagonal one that runs from behind our ears down to the top of our chest. You need to use a pinching motion. So you move along that, pinching the muscle, and if you find part that tender and shoots pain, just maintain that for 30 seconds. I think once you've done that 2 or 3 times, you'll do it very, very easily and very effectively. And it's something that you can easily do every day if you like. Anyway, thank you very much for watching. It has been most appreciated.